Good evening, everybody.
Hindi.
May kukunting issues lang kaming erase para sa lahat. Ang una-una, may listahan ang WHO nung parang kulatilya na magbigay kami, then they gave us a list of the persons who should be given the vaccine first jab. May mga grupo-grupo na tao. Ako naman, I remember that when we were discussing about the loans that we are applying for sa DBP, Asian Development Bank rather, and World Bank. As we were discussing it, I gave a list of priority in the ladder kung sino ang mauna. But apparently, this was not complied strictly. Kaya ang mahirap nito, ang nagbigay, ang WHO, yung COVAX, donated yan. So tinanggap natin, knowing fully well that we have to honor the conditions attached thereto. Ang nangyayari ngayon, hindi nasusunod. Kaya magalit yung mga health workers na dapat mauna, yung mga nurses, doctor, health workers. Ito yung tinatakutan ko noon. I remember very well admonishing everybody that the priority sa pagbigay ng bakuna ay ito ang masusunod. Wala pa yung COVAX. Yung akin lang, sabi ko, yung mga vulnerable, walang trabaho, kung may masakit at baka maagapan. So, I made a list, but they're all here, included in the list of priorities, including the WHO conditionalities. Hindi nasunod kasi may iba, ang balita ko, na ibigay sa mga anak ng mga artista at iba pa. Yung the favored few always. The penchant for, kaya nga kayo nagtatanong, bakit ka masyadong attached sa military? Wala mang alam yan. Hindi man ito, this is a mechanical act. It is not a study of medicine. Ano ito? Parang transaction sa negosyo. Kaya tinawag ko si Galvez, secretary, para siya ang magdala. You need not be a doctor here because you are transacting a business. It is not really a matter of medical science that you are talking of. So, mayroong mga tanong nila sa akin, bakit ka Duterte mahilig ka sa military? Sabi ko na hindi. Remember, sabi ko yung pera, ang pantawid mag-abot talaga sa mga beneficiaries. Turned out later that some non-beneficiaries o hindi kasali nabigyan, and worse yung iba nakihati pa ang barangay captains. Well, I'm sorry to say that yung umabot sa amin, nakademanda na. And it is really kaya hindi pa naibigay kasi kinuha na ninyo. That is malversation of public funds. ito ngayon, alam ninyo yung naintindihan ko. I understand fully well the psyche of the Filipino. We want to please everybody, especially friends. Parang unahin natin. Parang baka us first, tapos sila. That's the penchant of Filipinos. Ngayon dito maraming nawala sa listahan, not in the priority, and we are given the vaccine. Nandito yung mga pangalan, hindi ko na lang basahin. I will just let the Department of Health deal with you sa panahong pagkatapos ito. Yung God willing, kung at least mapagbakunahan na lahat, okay na. Do you know that there are 1.7 million? Yan sila ang nauna. In the front line, frontline workers in the health facilities, both national and local, private and public health professionals, mga doktor, nurses, sa ospital, dyan sa labas, nagtatrabaho, and non-professionals like students, nursing aides, janitor, barangay health workers, kasi sila yung lumalapit. Ito naman mga estudyante ito ng mga nursing, at ang mga doktor. Tapos ang sunod, the senior citizens aged 60 and above, disqualified na ako, pati si Secretary Lorenzana. Hindi na kami kasali. So dito pa lang sa first group, itong frontline workers, there are the number about 1.7 million. Tapos ang nagtira sa atin, about mga 400,000 na ibigay na. Ang sunod is the senior citizens, age 60, 75 na ako, and above, pagka may takot. We have to consult our doctors. Persons with comorbidities not otherwise included in the preceding categories. Yung may masakitin, afflicted with sickness and sickly. Yung may mga sakit. Frontline personnel in essential sectors, uniform personnel, and working sectors identified by the IATF as essential sa bakuna. Ito yung madapat mabigyan. Then the indigent population not otherwise included in the preceding categories. Yung mga mahirap. Then teachers, social workers, then government workers, and other essential workers, socio-demographic groups that significantly high risk other than citizens and indigenous people. Yung malayo, far from the madding crowd, sa mga doktor. Overseas Filipino workers, and then remaining workforce. Then last, the rest of the Filipino population not otherwise included in the preceding groups. Alam ko mahirap ito. And I said, I understand fully the psyche of Filipino. Basta, ano ka dito? Sumingit ka dyan. Yan yung style ng Filipino. Ang problema, dito pa lang tayo sa first group, sila lahat, buong Pilipinas, they number about 1.7 million. Ang ating stock na iwan dyan is about, I do not know the inventory. Can I ask the health secretary?
Magandang hapon po, magandang gabi po, Mr. President and fellow cabinet members, Senator Bongo, Chair of the Senate Committee on Health. Magandang gabi po sa lahat ng ating mga kababayan. As of March 23, Mr. President, ang naiturok na po natin, nabakunahan natin ay 508,332, which is 62%. Ang katumbas po nito, 62%.
Of the first group only.
Yes, Mr. President. And first dose only. Kasi meron po tayong second dose after 28 days, Mr. President. So, ang natitira pa rin pa po natin, kasama yung 400,000 kaninang dumating, will be about mga 900,000 pa ho ang natitira na doses. But this is not enough because the total delivery, which is about 1,525,600
Of the first group.
of the first group, Mr. President. Yan po, yung total na dumating is only about 30% of our requirement for the 1.7 million healthcare workers. Times 2 pa yun, Mr. President. 3.4 million ang kailangan natin na doses. So, kulang na kulang talaga yung bakuna sa ngayon, Mr. President. So, kailangan po talagang sundin yung ating pong priority listing na inyo pong binasa, Mr. President, para maging maayos po ang ating bakunahan program.
Let us rather trace the travel of the bakuna. Sino ang magpadala doon sa mga probinsya? Who's the guy in charge?
Meron po tayong DOH, Supply Chain and Logistics Management Office. Yung pong lahat ng bakuna sa ngayon ay dinideliver from the airport to the Metro Pack. Sa Marikina po, may malaking storage facility which is +2 to +8 degrees centigrade yung lamig. Kasi hindi po pwedeng hindi ho masunod yung temperature, sir. So, kailangan talaga mahigpit po yan.
So, just give me the travel of the bakuna. Down on.
Okay. So, yung pong galing sa Metro Pack, pupunta po yan sa, halimbawa, sa NCR. Sa NCR po, meron tayong region, DOH Regional Office. Tapos meron pong allocation yan sa mga iba't ibang mga hospitals. Yung pong number 1 na COVID dedicated hospitals, yan pong pupuntahan ng bakuna. Yung pong mga COVID referral hospitals naman po, dyan din pupunta yung mga bakuna, sir. Yung pong mga level 2 and level 1 hospitals, lahat po ng mga healthcare workers dito po sa mga lugar na ito, sila po ang uunahin na Mr. President. So, ganun din. Pagka dinala naman po sa Calabar Zone 4A, ganun din po mangyayari. From the DOH region, bababa po yan sa mga hospitals sa Region 4A. Ganun din po sa Region 3, Mr. President. So, meron na po tayong distribution channels na dideploy po natin lahat itong mga bakuna to the intended facilities and also a master listing of the intended beneficiaries or vaccinees, Mr. President.
If somebody goes wrong, who's to blame dito sa Manila?
Dito sa Manila, yung chief of hospital,
City Health.
At saka City Health Officer ho, para sa kanilang mga health facilities under their LGU jurisdiction.
Because once the vaccines are downloaded to them,
yes, sir.
Sila ang they have the responsibility to take care of it.
That is right, Mr. President.
Ayaw ko kasing alam mo, ordinarily, it's just a very small, it's trivial actually, under ordinary times. But in times like this, when we are only the donee sa mga donor at tinanggap natin yan with the conditions up attached thereto, dapat sundin natin. Kasi sinabi na sa atin ng country representative ng WHO, if you do not follow the list of priority, you might lose the assistance of the WHO. It was made clear to us na ganoon ang pagkasabi. Okay. Dito nangyari ito sa ikaw nang bahala, ayaw ko na lang magpangalan ng tao. It happened sa Parañaque. So, anak ito ng artista, kayo na ang bahala mag-imbestiga nito. Then kung matapos na ito, let your legal office handle or idiretso mo na lang sa make a report out of that incident and diretso mo na lang sa ombudsman. Mas mabuti, mas madali.
Mr. President, if I may,
Yeah.
kasama po natin dito ang DILG kasi under po sa DILG yung may jurisdiction po sila. So, sila po nagpapadala ng show cause letters dito po sa mga taong lumabag doon po sa atin priority listing.
Do you think that is possible? Because yung mga the ultimate person responsible for this are the health workers, city health workers, provincial health workers.
Yung mga officers ho, opo, sir.
Empleyado mo ito eh.
Hospital chiefs, yes sir. Mr. President.
So to make a story, the long story short, mag-execute na lang ng affidavit and why resort to the investigation and then send it to the ombudsman. Mayroon rin mga show cause orders issued by 5 mayors who jumped COVID-19, the vaccine line. Ito yung sumingit. Actually, ang number 1 dito is Mayor Alfred Romualdez of Tacloban City, Leyte. Then, you have Mayor Dibo Tuan of Tibuli, South Cotabato. Then Mayor Villalobos of South Cotabato. Mayor Noel Rosal of Legazpi City, Albay, vaccinated March 16. Nandito yung date ng ano nila. Mayor Abraham Iba of Batarasa, Palawan. Ang sabi nila na ito yung mga ang rason nila, I think that is a universal excuse na para hindi matakot yung mga constituents. Well, ako medyo gray area yan na dapat talaga ang una yung mga whether or not they jump the COVID-19 line of vaccination would require a certain amount of illegal study. So yun lang po. Sila yung may show cause order. Bakit sila ang nauna? Instead of following the seeing to it that the list is followed religiously at hindi nasunod. Meron ng dagdag pala dito, Mayor Elinito Peña of Minganilia, Cebu. Mayor Victorio Torres of Alicia, Mayor Virgilio Mendez of San Miguel, and Mayor Arturo Piolo II of Lila also. Yung iba hindi pa na tinutukoy pa nila. Ako dito, itong mga opisyal, if the purpose is really to show to the constituency that it is safe, may ako, hindi ko maano masyado. I said that there's a gray area there. Kasi nga, nung una sinasabi, turok ako, dapat ako ang mauna. They forgot that ako yung sa mga kategory ko is yung hindi na nga kailangan hayaan na lang kami. So I had to wait for I'm waiting for kung magdating kung makabili ka sa labas. Kung hindi naman, I can wait. It's not a sad story, but it's a commentary of our times. Marami talagang problema sumusulpot diyan sa whatever. Noong sa pera, nag-warning ako before. Sabi ko, tandaan niyo ito nga. And yet, many na demanda because they malfirst fund. Or, hati-hati nila, hiningi. Short-changing actually what ibigay dapat kinunan. Well, that is kung galing na sa kamay, nakalista na doon, natanggap niya, that is estafa. Or other forms of swindling, that is Article 318, the revised penal code. Other form of deceits, if it does not fall squarely on the crime of estafa. For the information of everybody, ngayong gabi dadating yung, is it tonight? Dadating yung the remaining 400,000. Ang dumating, puro donation, China gave 500,000 plus, then they rounded it to 1 million. So, may bakuna, pero hindi binayaran ng pera ng gobyerno. Yung AstraZeneca na binigay ng WHO, magkano yun lahat, Secretary?
Yung pong dumating na AstraZeneca, 525,000 doses po, Mr. President.
So, donated rin yun.
Yes, Mr. President, through the COVAX facility.
So, sa mga kaibigan ko, just to refresh your memory, every time we meet her, I've stressed the point that ang dumadating puro donated by the WHO and China. Wala pa tayong bakuna. Sabi mo, saan ang bakuna? Bakuna na bili? Wala. Wala tayong bakuna na bili. Wala pa. Kung magdating man, mga next week siguro, then that would be the time that they would notify kayo, si Secretary Galvez. Well, ring the bell for the World Bank to record it at yun ang babayaran. Babayaran nila doon sa nabili natin. I think it's China. 1 million. Yung 1 million binigay yon. We are expecting another 1 million na galing China. Ito, kasi parang nahiya na tayo. Bibili na natin to. So that is the time na may bakuna, mayroon. Ito, gamit ang kwarta ng tao. May bakuna na saan? Wala. Meron, pero hindi bayad sa taong bayan. Just to complete the story. Kasi mahirap tayong makaintindihan dito. Wala pa hanggang ngayon, at this very moment, and up to this time, there is no bakuna na binili natin na dumating. Wala pa yan. Medyo malayo pa. But next week or hopefully week after. Basta sana, I pray that it would happen within the month of March. That is para maano na tao na